So for the next topic, we're going to talk about the trace and toxic elements. First one is the lead, which is a soft, bluish, white, highly malleable and ductile, and it is a poor conductor of electricity and heat, and is resistant to corrosion. The lead is used in the production of storage batteries, ammunition, solder, and foils. The tetraethyl lead, which was used for sa gasoline or sa mga petrol, increases the fuel octane rating and is present in many paints. The exposure to lead is primarily respiratory or gastrointestinal, and it also distributes to soft tissues such as liver, kidney, and brain, with the skeletal lead concentration containing greater than 90% of the body burden of lead. For the health effect and toxicity, it usually affects the children, lalo na kapag naglalaro sila ng, sa pain, sinabi na dati nun, sir. So in children, the blood levels of there is a toxicity at the blood levels of 60 microgram per deciliter or higher, and the IQ declines are seen at blood levels of 10 microgram per deciliter or higher. For the adults, the symptoms includes the peripheral neuropathy, motor weakness, chronic renal insufficiency, systolic hypertension, and anemia. And other symptoms and conditions may include clumsiness, gait abnormality, headache, behavioral changes, and seizures, and severe cognitive and behavioral problems, which is usually seen in children, and also the gastrointestinal symptoms such as abdominal pain, constipation, and colic, and acute nephropathy and anemia. The lead exposure primarily arises in two settings. For the children, nakuha yan sa mga paint chips, and for the adults, sa mga occupation, so like sa smelting, mining, ammunition, soldering, plumbing, and ceramic glazing and construction industry. So the specimen used is the whole venous blood, and it is preferred over plasma or serum because the circulating leads is predominant on the red blood cells. The urine lead is used to detect present exposure to lead or to monitor chelation therapy, and the screening tests used for occupational exposure are the plasma aminolevulinic acid, and the preferred method is the ICP-MS or the inductively coupled plasma mass spectrometry. Next.
Okay, so the next is the mercury. Mercury, it is also called as quicksilver, or it is a heavy and silvery metal. It is one of the only two elements that is liquid at room temperature and pressure. For your information, the other one is the bromine. So mercury, it is widely used in the production of eyes cosmetic, especially in mascara. It is also used in dental amalgams, electronic switches, germicide, fungicides, and fluorescent light bulbs. So next, we have the health effects and toxicity. Mercury-based preservative can cause or trigger autism in children. Organic mercury and elemental mercury vapor are toxic to both the central and peripheral nervous system. Elemental mercury readily vaporizes, and its inhalation can produce harmful effects on the nervous, digestive, and immune system and the lungs and kidneys. The inorganic salts of mercury can affect the skin, eyes, gastrointestinal tract, and kidneys. Mercury intoxication can manifest in many signs and symptoms that affect several organ systems, including the headache, tremor. Tremor is the involuntary movement of the parts of the body. Example of this is the hand. Yung kapag mag-isa niyang nanginginig or mag-isa niyang gumagalaw, one of the conditions that possibly described is the tremor. Next is the impaired coordination, the abdominal cramps, diarrhea, dermatitis, polyneuropathy. Itong polyneuropathy, it is the simultaneous malfunction of many peripheral nerves throughout our body. And the next is the proteinuria and hepatic dysfunction. So in the laboratory determination or evaluation, we have the ICP-MS or the inductively coupled plasma mass spectrometry and the vapor atomic absorption spectroscopy. And it is usually determined as total mercury levels in blood and urine without regard to the chemical form. So the next.
Next is manganese. It is the 12th most abundant element in the Earth's crust. At ang manganese ay widely used in fertilizers, animal feeds, pharmaceutical products, dyes, paint dryers, catalysts, and wood preservatives, at pati din sa production of glass and ceramics. Ginagamit din ang manganese sa production of the alloy ferromanganese and dry cell batteries. At ang manganese, ang manganese ay normal component ng tissue na may pinakamataas na level na natatagpuan sa fat and bone. And elimination occurs predominantly through the bile. Health effects and toxicity. Experimental manganese depletion ay blood clotting defects, hypocholesterolemia, dermatitis, elevated serum calcium, phosphorus, and alkaline phosphatase activity.
So kasama din dito ay low levels of manganese is epilepsy, sleep abnormalities, joint disease, congenital malformation, heart and bone problems, and stunted growth in children. So toxicity, nausea, vomiting, headache, disorientation, memory loss, anxiety, and compulsive laughing or crying. Chronic toxicity resembles Parkinson's disease with akinesia, rigidity, tremors, which is yung sinabi ni Queenie kanina, is yung involuntary movement ng, for example, yung sa kamay, and mass life phases, and a clinical condition named leukorrhea manganica. Ang leukorrhea manganica, it is a reversible neuropsychiatric syndrome, and a manganese madness was described in Chilean manganese miners with acute manganese aerosol intoxication. So lastly is the laboratory determination. It is measured by ICP-MS, or also known as inductively coupled plasma mass spectrometry, and GFAAS, which is called graphite furnace atomic absorption spectrometry. And urine manganese is used in conjunction with serum manganese to evaluate possible toxicity or deficiency. So that's all for trace and toxic elements.
Okay, to sum it up, the lead, it is a poor conductor of heat and electricity, and it is usually found in the production of the batteries and ammunition. And usually naapektuhan na organ is the respiratory and the gastrointestinal, but it can also be in the soft tissues. For the children, nakuha nila yun sa mga paints kapag naglalaro sila, keme-keme. For the adults naman, sa weight nila nakukuha yung kapag nagmimina sila or what. And the specimen of choice for the lead is the blood, probably the whole venous blood. The next one is the mercury, which is liquid at room temperature, and they are used probably in some dental amalgams, sa cosmetic, probably yung sa eye cosmetics, especially the mascara, and even they are also used in tattoo pigments. And the kidney is the major storage organ after the inorganic exposure, and they have the highest level at the kidney, liver, spleen, and brain. That's why I expect mo na yung mga symptoms or conditions is yung liver sa mga glass and ceramics, wherein they have a highest level at sa fat and bone, kaya yung mga conditions is yun related siya sa mga bone, and for the yung blood clotting defects. So the specimen of choice here is the urine, and these three, they uses the laboratory method called inductively coupled plasma mass spectrophotometry, and that's for group C1.